Sir, you are live now. You can start.
Should I share the screen now?
Yes, sir, you can share your screen.
Okay.
Yes, sir. Sir?
Yes.
Yeah, so you can start your presentation.
Okay.
Yeah.
So thank you, IGCP Publications, founded by Honorable Dr. K.K. Agarwal, whom I met quite a lot of times during all the conferences. And his trademark was he used to keep his stethoscope around his neck every time in every function. So once I asked him, "Yes, sir, why you keep this stethoscope?" So he very politely told that this is my identity. So I liked him very much, and I start this lecture paying tributes to him. He was a great personality. And today's topic is low blood pressure, how to handle this non-entity. So this is rather important because when we talk about low blood pressure, I remember 41 years back, my third year days, when I was taking case history of a patient, and he told me that doctor साहब मेरा blood pressure low रहता है. So when I checked her blood pressure, it was 110 by 70. So it was normal. But during the history, she told me कि मेरा blood pressure low रहता है. So I tried to find out the low blood pressure entity in our book. That was, we were reading Davidson, and I couldn't find any chapter or anything regarding low blood pressure. So my senior, Dr. Gurpreet Singh Wander, my all the academic pursuits are because of his motivation, and tributes to my late father, comrade Ved Prakash Gupta, and my family. So he told me that it is a non-entity. Why? As such, there is not mentioned as a disease, but generally as a consequence of other problems. There is no chapter or guidelines by the name of hypotension, as there are for hypertension. So that was an enlightening period 41 years back, that hypotension is definitely a non-entity, but a very important problem. And first known use of word hypotension was in 1893, and subsequently very important article was published in New England Journal of Medicine, Hypotension, the ideal normal blood pressure. So in 1927, Norris described individuals with low blood pressure as persons who lacked stamina, tired easily, complained of cold extremities, and showed an inability to do prolonged mental or physical work. He was quoted as saying, "They are not exactly ill, yet they are rarely well." So clinical picture of hypotensive subjects have been accepted quite generally, and is the syndrome discussed in this paper, which states we are not concerned with such diseases as Addison's disease, coronary thrombosis, status lymphaticus, shock, or infectious diseases which may be accompanied by low blood pressure. The problem we shall attempt to clarify is the state of individuals who has for long time had a low blood pressure and who may complain of lack of viability, fatigue, vague digestive upsets, and loss of weight. So in this few slides, we are also going to talk about the hypotension, which has got at least no cause for hypotension. So what is hypotension? Hypotension is a decrease in systemic blood pressure below the accepted normal low values. But there are no accepted standard hypotensive values as such, but pressure less than 90 systolic and 60 diastolic are recognized as hypotensive. Hypotension is a relatively benign condition that is under-recognized mainly because it is typically asymptomatic. It only becomes a concern once pumping pressure is not sufficient to perfuse key organs with oxygenated blood. So if hypotension is leading to hypoxia, that is decreased blood supply to the key organs, only then it becomes a disease or matter of concern. Otherwise, generally the patients are having low blood pressure are asymptomatic. They don't have any symptoms. So what is blood pressure? Blood pressure is modulated. Blood pressure is cardiac output multiplied by systemic vascular resistance. And we all know cardiac output is equal to stroke volume into heart rate, and systemic vascular resistance is equal to 80 into mean arterial pressure minus mean venous pressure over cardiac output. So any disease that impacts one or more of these parameters may induce hypotension. So if it is affecting stroke volume, heart rate, mean arterial pressure, mean venous pressure, or cardiac output, these factors will affect the blood pressure and cause hypotension. So what are the types of hypotension? First and foremost, what we are going to discuss today is benign or idiopathic hypotension. Other are hypotension because of distributed shock, that is failure of ability to maintain total peripheral resistance by maintaining cardiac function, attempting to compensate, that is anaphylactic allergic reactions and septic shock. Cardiogenic shock, that is failure to achieve sufficient cardiac output with maintained total peripheral resistance. Hypovolemic shock, loss of total blood volume, blood pressure is not maintained, cardiac output and total peripheral vascular resistance are maintained. So it is basically dependent upon the total loss of blood volume. Obstructive shock, obstruction, constriction, or compression of cardiovascular system. And combined type of hypotensive shock is when one or more types of shock are combined, that is disruptive shock, cardiogenic shock, hypovolemic shock, or obstructive shock. Any combination of these four, we can describe it as combined type of hypotensive shock. So this slide is really important because we are going to discuss the benign or idiopathic hypertension where there is no cause and patient is generally symptomatic or asymptomatic. The other type, that is disruptive, cardiogenic, hypovolemic, or obstructive, if there is hypotension, we treat the cause and so we treat hypotension. So meditation, yoga, or other mental psychological disciplines may produce hypotensive effect. Lower blood pressure is a side effect of certain herbal medicines which can also interact with several other allopathic medicines. So generally we feel that Ayurvedic medicine or herbal medicines are side effect free, but it is a misnomer, it is a myth. They can cause severe side effects, especially can lower the blood pressure in some cases. An example is this, that there are certain plants like cocoa tree or cocoa tree plant which lowers the blood pressure through its action as both a vasodilator and has diuretic effect, and has been used to treat high blood pressure also. So what are the signs and symptoms? Asymptomatic and their low blood pressure is normal for them. So generally, majority of the patients are asymptomatic. The chronic sufferers of low blood pressure would need to seek medical consultation if they experience. So if they are symptomatic, they will have lightheadedness or dizziness. They can have nausea. Chronic fatigue can be there. Whole day they are feeling fatigue, cold, sweaty skin, palpitations, shallow and rapid breathing, confusion or mental lag, loss of consciousness, and weak pulse. So if they are symptomatic, these are a few symptoms which will be experienced by a person who is having low blood pressure. Symptoms are generally related to cause of hypertension. The cause we have already discussed, but if you don't find any cause, we call it as benign or is this thing hypertension. So sometimes what happens, as I have discussed that in my third year, there was a misnomer of low blood pressure. Patients who have psychosomatizations, anxiety, depression, or fibromyalgias, or the symptoms we have described in the previous slide, they can come to your OPD and say, "Okay, I have low blood pressure, या मेरा blood pressure low रहता है." So when we check the actual blood pressure, it is not low. So sometimes the low blood pressure described by the patient is a misnomer, and because of psychosomatization, anxiety, depression, fibromyalgias, etc. So even if a patient comes to us with the history of low blood pressure, we must check the blood pressure that actually patient is having low blood pressure that is less than 90/60 millimeter of mercury, or the blood pressure is normal and patient feels that it is less. Chronic hypertension is often not clinically addressed because the vast majority of hypertensive individuals remain asymptomatic. So there are evidences supporting association between asymptomatic hypertension, cognitive deficits, adverse change in mood, and quality of life. So there are studies which show that if patient is having low blood pressure, the cognitive deficits, adverse changes in mood and quality of life, poor quality of life can be attributed to low blood pressure. And again, we think that this is normal and it is asymptomatic. Compared to normotensive age-matched controls, otherwise healthy subjects with chronic asymptomatic hypertension are reported to have slowed cognitive speed, fewer word recall, decreased accuracy of response, limited attention, prolonged reaction time, and reduced memory and concentration capacity. So people may have these problems even if they are labeled as asymptomatic hypertensives. In addition, several papers have reported findings suggesting significant association between chronic hypertension and increased incidence of depression, anxiety, unexplained tiredness, and poor perception of well-being. Increasing in the systolic blood pressure secondary to administration of antihypertensive agents, that is mindorelin, and has been shown to increase cerebral blood flow at rest and is response to cognitive testing, which was associated with improved test performance in hypertensive controls. So there are a few studies where people with these problems have been given antihypertensive agents and their problems have improved. So what is the treatment? Low blood pressure that doesn't cause signs or symptoms or cause only mild symptoms rarely require any treatment. If symptomatic, the treatment of hypertension should be focused on reversing the underlying etiology. So this is very, very important. If some person is having low blood pressure and we try to ascertain the cause, and once we find the cause and we treat it, so that is the treatment of hypotension, and it will depend upon the etiology. If cause of low blood pressure is not clear or no treatment exists, the goal is to raise your blood pressure and reduce signs and symptoms. So that can have non-pharmacological management and pharmacological management. Pharmacological management is very rarely needed. And what are the non-pharmacological modalities? So this picture shows very aptly that non-pharmacologically how we can improve the blood pressure. So eating a healthy diet with fewer carbohydrates, we can have smaller meals which will increase our blood pressure. Avoidance of alcohol is very, very important because alcohol is producing hypotension, and people with really low blood pressure, if they take alcohol, the blood pressure further decreases, so which can be symptomatic. So avoiding alcohol is one important factor. Avoid standing for long periods. So we can intermittently sit. Wearing compression stockings, if we are not, our occupation is like that, so we must wear compression stockings, which will help increase the blood pressure. Drinking plenty of fluids. So again, this is very important modality, especially in hot, humid areas or in summers. We can drink plenty of fluids with, in fact, salt also, if it is recommended. Avoid sitting up or standing up quickly. So that will be causing postural hypotension. So if we avoid, we sit for a long time and quickly stand up, there is a redistribution of fluids and we can have symptoms of hypotension. So medicines are fludrocortisone and midodrine are indicated if there is chronic hypotension, which is symptomatic and which is not treated with these non-pharmacological methods, what we have already discussed. So we have discussed the benign or hypotension where no cause has been found. If there is cause, we can treat the cause, and so hypotension is treated. So my dear friends, evaluation is dependent on suspected cause. Prognosis of benign hypotension is very good, and majority of the patients are treated with non-pharmacological management, and only a few may require medicine. Symptomatic hypotension has a variable prognosis depending upon etiology and severity. So these are the four pictures of different patients. So one may be very confused after knowing that I am having hypotension, other may be stunned, and other may not find any problem that I am having hypotension. So take home message is hypotension is a non-entity where there is no chapter or no guidelines for hypotension, and hypotension basically is evaluated to find out the cause. If there is no cause, we call it as benign hypotension, and majority of benign hypotensives are asymptomatic. Only a few may need non-pharmacological management and rarely pharmacological management. And if we find the cause for hypotension, we treat the cause, and that is how we treat hypotension. So it is a important condition as such a non-entity, but now it is gaining focus, increasing day by day. Thank you very much. With this, I invite you all for 10th Annual Conference of Association of Physicians of India, MAPICON 2023, from 21st to 24th September at Hotel Seppal, Bathinda. For this, 16 credit hours will be awarded in future. Thank you very much.
So there are two questions from audience are just posted in the private chat. Can you just check it?
Okay, should I check the chat box?
Yes, sir. These are the questions from audience.
So what is the dose of vasopressin have to be used to treat systemic hypotension? So basically vasopressin is generally used when there is hypotensive shock. So it will depend upon the cause, and we start with low dose and we try to maintain the blood pressure. So that is more than 90 systolic. And that is how we are going to titrate the dose. So there is no specific dose. If it is needed, we need to increase the dose. Any experience with sertraline used for intra hypotension when other causes fail? No, I have not used, and it is not indicated. It is not mentioned anywhere as treatment of hypotension as far as sertraline is concerned. So any other question?
No, sir, this was the two questions. Thank you so much.